Canada is often praised for having a universal healthcare system where everyone is treated equally and has access to care regardless of income or background. And growing up, I always believed that this meant the healthcare system in Canada was fair and that everyone receives the same quality of care and has equal health outcomes. But after learning more about the healthcare system over these past few years in health sciences, I've realized that this belief reflects what's called truthiness, which is something that feels true but doesn't actually reflect what is reality. The idea that Canada provides equal healthcare for all is rooted in policies like the Canada Health Act, which is from 1985, and it promotes principles like universality, which means everyone's covered, and then accessibility, meaning care should be provided without financial barriers, and these principles are meant to ensure all Canadians can access medically necessary healthcare services. In reality, there are significant disparities in health outcomes across different populations in Canada. Indigenous communities, for example, are experiencing the lasting impacts of colonialism and systematic racism, which continues to shape the health of Indigenous people in Canada. 1 in 5 Indigenous people have reported to face discrimination in a healthcare setting in a survey in 2024. Many communities, especially those in rural areas, face significant barriers to accessing healthcare. And in addition, higher rates of poverty, food insecurity, and limited access to stable housing and education contribute to poor health outcomes and an increased risk of chronic illness. These challenges are further compounded by ongoing experiences of discrimination and racism within the healthcare system. These inequalities are clearly reflected in national data. From 2016 to 2021, life expectancy was approximately 74 years for First Nations people, 80.5 years in Métis people, and 71.9 years for Inuit populations. And these are significantly lower than the 85 years observed for non-Indigenous Canadians. This gap over a decade highlights a major health inequality, showing that while Canada's healthcare system is designed to be universal, the outcomes are not equal across populations. One key factor contributing to these disparities is implicit bias in healthcare. Implicit bias refers to unconscious attitudes or stereotypes that influence how healthcare providers perceive and treat patients, often without even realizing it or doing it on purpose. Research shows that these biases can have serious consequences. Like, for example, women are 3 times less likely to be referred for certain procedures, like knee replacements, even when clinically appropriate. Black and Hispanic patients are less likely to receive pain medication over white patients, and when they do, they often receive lower dosages despite higher pain levels. Elderly patients are less likely to have suicidal ideation treatment, even though men aged 85 to 89 are at particularly high risk for suicide. Women are less likely to be diagnosed with COPD, which is chronic obstructive pulmonary disease, over men, despite having similar symptoms and medical histories. Obese patients are implicitly associated with negative stereotypes by healthcare providers. Lesbians and bisexual women report lower rates of timely pap tests over heterosexual women, with many reporting that they've never received a pap test. These biases can affect every stage of care, from diagnosis to treatment decisions to patient interactions. Even subtle behaviors such as reduced eye contact or less empathetic communication can negatively affect patient trust and outcomes. And importantly, these disparities are not usually the result of intentional discrimination. Many healthcare providers are committed to fairness, but implicit biases operate unconsciously, shaped by societal influences and past experiences. From a legal perspective, Canada guarantees access to medically necessary services, even though some populations, such as Indigenous communities, continue to face barriers in accessing care. But Canada does not guarantee equal outcomes or identical experiences for all patients. And this is where ethics becomes kind of important. The principle of justice in healthcare is not just about treating everybody the same, but about ensuring fairness. This introduces a distinction between equality and equity. Equality means giving everybody the same resources, while equity means adjusting care to account for differences in need and circumstance so that outcomes can be more equal. So, while Canada's healthcare system promotes equality in theory, the reality is just more complex than that. The belief that everyone receives equal care is not entirely true, and in many ways, truthiness. Understanding this gap between perception and reality is essential if we want to move toward a healthcare system that's not just equal, but is truly equitable for all.